Dr. Vincent Fortanasce is a clinical professor of neurology at USC. He is board certified in neurology and rehabilitation medicine and trained in psychiatry at the Institute of Living, a Yale affiliate hospital. Dr. Fortanasce is the author of The Anti-Alzheimer's Prescription, a best-selling book aimed at preventing Alzheimer's disease. He is also the founder of the DEAR and Team Lifestyle programs. In addition to an illustrious medical career, Dr. Fortanasce was twice voted Outstanding Lecturer of the Year at USC. He has been honored as a member of the Best Doctors in America and has received commendation by former President Clinton and former California Governor Wilson. Dr. Fortanasce was an Olympic athlete and inducted into the Little League Hall of Fame. Dr. Vince is a co-founder of the Fortanasce Center, a leading institute dedicated to sports medicine, physical therapy, and education. Now, here is Dr. Vincent Fortanasce.
Hi, I'm Dr. Vincent Fortanasce. I've come here to talk to you about the TEAM method. TEAM stands for Treatment of Early Alzheimer's Disease and Mild Cognitive Impairment. Many people don't realize that we're in an epidemic right now of Alzheimer's disease. There are approximately 6 million people in the United States that have been diagnosed to have it, and another 10 million that we consider to have what we call mild cognitive impairment. Of those 10 million people with mild cognitive impairment, we estimate approximately 80% of them are going to develop Alzheimer's disease. At present time, it is felt that once you develop mild cognitive impairment, there is little that can be done. And when you have developed Alzheimer's disease, nothing can be done. This is very similar to what I was told when I had written the book, The Anti-Alzheimer's Prescription, that there was no such thing as prevention of Alzheimer's disease. Since I've written my book in 2008, there have been over 23 other books identical to mine, all saying the exact same thing. Most disconcerting is the fact that in 1953, there were diagnosed of approximately 500,000 cases of Alzheimer's disease in people over 65, and less than 25,000 in those under 65. Today, the rate of Alzheimer's disease in those under 65 has increased almost 22-fold. What's the reason for this? It's obvious. It's our lifestyle. It's what we call our SAD lifestyle, a sedentary, aging population who has a diet that's full of trans fats and carbohydrates. Well, I've started the TEAM program primarily because, just like I thought Alzheimer's disease could be prevented, I do believe that we can make a reversal, especially those in people who have mild cognitive impairment, and even those who have early Alzheimer's disease. What is mild cognitive impairment, and what is Alzheimer's disease? Alzheimer's disease is a type of neurodegenerative disease that really starts with recent memory loss and then finally ends in a person not being able to even recognize their own family and unable to even walk or do regular activities of daily living. It affects the entire brain. Mild cognitive impairment is a state in which, at a person's age, they're just below what you would expect them to be, that is, cognitively. And that's meaning their executive functioning, their recent memory, their attention and concentration, and even their overall intelligence and language. They begin to forget names, even people who they know well. It's important to recognize this state. We have an examination that is called the VMS, or Vital Mental Status Examination, which picks up people who have mild cognitive impairment and early Alzheimer's disease. If we could get these people and those with early Alzheimer's disease, I believe the method I'm about to show you will work. First question is, do you have Alzheimer's disease? And it's a difficult thing to define. The real problem with Alzheimer's disease and even mild cognitive impairment is that people don't recognize the fact that they are losing their memory. Often a telltale sign of a person who does have it is one who is brought in by family members. The current belief is that people who have Alzheimer's disease, there is nothing we can do for them except to care for them. Now, and what we do know now, which we had not known years before, is the fact that we have a mental capacity. And that mental capacity can continue to grow without fail throughout our lives. And the reason why we have this is that our memory, our ability to cogitate, or what we call cognition, is dependent on brain cells and its connections. And it's actually this mass of connections that causes our ability to have good executive functioning, to have good intelligence, to make the proper decisions, to be able to have good insight into our own activity and that of others, to make judgments on what we should do financially. And it is often during the mild cognitive impairment that people start to make poor judgments. I've seen a number of people lose their fortune because of their inability to recognize that the people they were dealing with were dishonest. And in fact, often think that their own family members are trying to take advantage of them. They seem to lose their ability to judge, the ability to have insight. And these are often the very beginning signs of what we call mild cognitive impairment and early Alzheimer's disease. But now we know that no matter what age we are, that those dendrites, or what we call connections, and brain cells can be increased in size and in number no matter what age we are. And that is what the TEAM program is all about. The first step is that we begin to realize that our brain is not a fixed bank account, but really an interest-bearing account. If we use it, we will not lose it. But if we do not use it, we will lose it. So what I've designed is a program in which it's been proven scientifically that these exercises, both physical and mental, increase the number of cells, and they increase the number of cells in a very vital area, a place called the hippocampus. The hippocampus is a place where our memory and learning occurs. And then those things are filed in what we call the frontal cortex. And this is our intelligent brain. This is what makes us different from the animals. And this, unfortunately, both the hippocampus and the frontal cortex, what degenerates in both mild cognitive impairment and in Alzheimer's disease. In fact, the entire brain undergoes a degeneration. One of the early signs of Alzheimer's disease and mild cognitive impairment may be a loss of smell, and that's one of the therapies that we start instituting early. A Dr. Fred Gage found that we could increase the number of cells and connections. He called it neurogenesis and neuroplasticity. And as you can see in this slide, first is exercise. The second is neurobics, or brain exercises. And the third is socialization. We found that through a certain type of exercise that would exhaust the muscle, it would release an enzyme called IGF-1. And this would produce and provoke brain-derived trophic factors that would actually affect the genes that would cause increased muscle size, increase in the density of the bone. And another gene would be set on called CRG1 and 3 that would actually increase the number of cells and dendrites or connections. And so, yes, we can regrow these things. The same thing happens with an increase in number of connections when we do neurobics or brain exercises. The usual way of doing neurobics is everybody thinks of puzzles. But that's only one small part. What you have to understand is that we have something called email. It's our cognition. We have to we have to constantly try to use our executive functioning, our recent and remote memory, increase our attention, increase our overall intelligence for music, for languages, and increase also L, which is in the email, stands for language. Finally, there's another mnemonic that we use. It's HE test, and that essentially has to do with all our hearing, our eyesight, our taste, our emotions, which is one of the most important types of sensations that we have. Also our sensory function. And finally, T for our touch. The T method, that is the treatment of early Alzheimer's disease and mild cognitive impairment, is extremely important because what I use is the most recent science. What it'll include is, number one, an exercise regimen that you'll do. Then the individual who is affected will then have aromatherapy and then go into a number of other scenarios that will increase each and affect each part of the brain itself. I will now give you an example of what this approach is. Today I have with me Damien Chase.
Hi, Doctor. Thanks for seeing me today.
Damien, by the way, is not a patient. He's, in fact, the therapist who will be doing many of the therapies with you and will be teaching these therapies. Now, first I will be starting with what we call the isometric exercises. These are the exercises that have been found to act like miracle grow. What will happen is we're going to put both fists in front of us, all right? We're going to tighten our fists. We're going to tighten our forearms. We're going to tighten our biceps. And then the scapular in between our scapulars, we're going to tighten that, but we'll keep our neck nice and loose. Now we're going to tighten the fist a little bit more, and we're going to tighten the arms a little bit more. Don't hurt yourself. And then count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then relax. Then do it once again. Tighten the fist, tighten the forearms, tighten the biceps, tighten the scapula, keep the necks loose, and then count again.
1.
And remember, if you're having difficulty with your shoulders, you can lower them. If you feel you want to raise your arms a little bit more. And what you're beginning to do is you're going to be beginning to feel your muscles burn. It is when those muscles are burning that they're giving off that IGF-1, that signal that goes to the brain that causes the production of brain-derived trophic factors that then eventually will turn on those genes that will cause neogenesis and neoplasticity, and that is increased number of cells and increased connections, especially in the frontal cortex and in the hippocampus. So we begins with this so that we have some cells and connections increase in order to work with them. Now the second thing we're going to do, all right, is what we would call aromatherapy, and this is sort of a neurofeedback type thing. I like to use those scents that are particularly important to the person that you love. So if you know that they always love peanut butter, if you know that they love coffee, and that is going to provoke certain memories. For instance, I always like talcum powder. You'd be surprised what memories that evokes. And you don't have to be carrying these things around with you. In fact, you can get the pill box, all right? In this pill box, I have some basil, me being Italian, that evokes a lot of wonderful memories. I have lemon in here, and that too, lemonade. I have the talcum powder, and finally, the coffee. And so what I would do to the individual, all right, your loved one, is that I tell them to close their eyes, all right, put their hand like this, and I ask them to smell. Okay. What do you smell?
It's coffee.
And what memories does that evoke in you?
I remember as a child, my father would always have coffee in the morning, and before I went to school, I remember the smell of the coffee brewing, and that was a good memory.
Good. Okay, close your eyes again. Smell. What do you smell?
It smells like lemon.
Mm-hmm.
And my grandmother used to make lemonade, and I remember she had lemon trees in the backyard, and she would make her own lemonade, so I'm reminded of her house in the backyard.
Mm-hmm. Close your eyes. And of course, I just made a mistake, but that's all right. I smell that.
That's peanut butter.
Yes. And what does that remind you of?
My mother used to put peanut butter sandwiches when I went to school as a child, and I remember that.
You love your mom?
Sure.
Ah, great. I love my mom. Well, now what we're going to do is we're going to go to the next part. And I'm going to say, Mary had a little
Lamb.
Humpty Dumpty sat on a
Wall.
I left my heart in.
San Francisco.
All right, very good. Now, what did you have for breakfast this morning?
I had an egg white omelet.
Okay, good. Now, let me ask you, what were the three substances I asked you to smell?
Peanut butter, lemon, and coffee.
And what did the coffee remind you of?
Coffee reminded me of my father used to drink coffee, and before I went to school, I could remember smelling it from upstairs.
All right, it's very important now, because what we are now doing is that the reason why we're using aromatherapy is the hippocampus is the main area that is most affected in mild cognitive impairment and in early Alzheimer's disease. It's the area, it's a small little area in the brain. What you're seeing here is the normal ramifications or connections or dendrites connecting with one another. And there's something interfering with the connections, actually destroying the connections. And what we are doing is trying to increase the number of cells through the isometric exercises and increase the number of connections, especially in an area which is close to the hippocampus, and that is the olfactory apparatus where we get our smell. And this is one of the reasons why aromatherapy in several papers has been shown to increase and ameliorate memory, and at least some, in many of the papers, stopped the progression. So this is just one of the things. And then I would say, after that, I would usually sing some songs. And one of the ones that my dad always loved was, California, here I come, right back. And you'd use any song that they really knew. I used this with my mother, who's 99. Another one we might want to use, and you could write these down, you could find these on the line, is Julie Garland's Over the Rainbow. Somewhere over the rainbow. Go with me.
Way up high.
Way up high. By the way, you can tell we're not professionals. Somewhere over the rainbow, skies are blue. And dreams that... Yeah, well, anyway, you could say that I need a lot of work. Anyway, you get 3 or 4 songs, all those songs that you know engender memories, and are really the best ones to get are the ones that they would sing between 18 and 25 years of age. They are the most engaged, and they are the ones that stimulate most of the memories. And remember, those emotions, those memories, every time you bring them up, they're bringing up new connections, replacing the connections that have been destroyed. What I also like to do is show pictures. You know, one of the ones is you could show the picture of their husband, of their some of their children, especially when they were much younger, and have them identify them. And then, of course, you always come back and you say, what were the 3 aromas that you smelled?
Coffee, peanut butter, and lemon.
And what were the words that finished the song? You know, and then you go, what song? So, in that way, we are going to have at least 25 different scenarios that you can go over. I really advise to go over the same ones over and over until the one you love starts getting it. All right? We do mental statuses at the beginning of the team method, and then again in 3 months to try to demonstrate that there has been a marked improvement. Now, the team method not only helps the individual with mild cognitive impairment or early Alzheimer's disease, but also helps the caregiver. One of the major problems that I have found with caregivers is burnouts. And the reason why they burn out is because they feel hopeless. Nothing that they can do to influence or to improve their loved one's mental cognition. But the answer is that they can. And I believe that this not only will give the caregiver some hope and decrease burnout and depression, but it will help the individual with mild cognitive impairment. So the new science has clearly shown that we do not have to lose our capacity, that we can regrow it, we can maintain it, but we have to have a method to do it. And that method is what I call the team method. I believe that it'll work. I will prove as best I can that it will help your loved ones. And at least we will make an effort. It is better than what we have right now. The only thing we have now are medications that don't work. All the medications that we have, such as Aricept, Exelon, Namenda, these are only like high-test gas to a broken engine. They may help attention and concentration for 3 to 6 months, but they do nothing to reverse the disease. They do not build new neurons. They do not build new connections. The team method, we hope, will. We have a brain health lab that has over 500 programs that we bring people in to learn neurobics, to have them do computer games, to increase their mental capacity, to increase their mental agility. And it's sort of a neurofeedback. We also teach relaxation techniques through biofeedback to improve their sleep, to improve their control, to decrease their anxiety. I hope you will afford yourself of the opportunity to help the ones that you love. I will give you one little scenario. When my mother turned 90, I gave her a small examination. I realized that there was just something wrong. And I asked her 3 words. And after 3 minutes, I asked them again. I gave her that little VMS exam. She remembered none of the 3 words, even with hints. I started this program with her. And last year I went back and I said, Mom, I'm going to give you 3 words again. I want you to give them back to me in 3 minutes. Well, after 3 minutes, she gave me 2 of the 3. When I gave her 1 hint, she gave me the 3rd. My mom had just turned 99. This program, from my personal experience, works. And I hope it'll work for you.